Mr. Chairman, our nation continues to face existential threats from infections, viruses, and even poisoning from illicit and illegal narcotics. As we recently saw during the COVID-19 pandemic, how we address public health can drastically affect how we live and function in our daily lives. As we look past the COVID-19 pandemic to possible threats on the horizon, I'm concerned with the rise in antimicrobial resistance AMR. It's crucial the CDC takes action now to avoid potential catastrophic events. Data from the CDC shows that globally, one person contracts an antibiotic-resistant infection every 11 seconds, and every 15 minutes someone dies. And an estimated 2.8 million Americans get antibiotic-resistant infections each year, leading to over 35,000 deaths. If no action beyond the current initiatives are taken, then given the global life expectancy will fall by 1.8 years over the next decade due to AMR. Drug-resistant infections also create a substantial economic burden. The additional costs of treating resistant infections are estimated at $4.6 billion annually in the U.S. alone due to factors like extended hospital stays and more expensive medications. Studies show that only 30 to 50% of antibiotics are prescribed appropriately. Dr. Jernigan, what more can be done to strengthen antibiotic stewardship, and how should we ensure that diagnostics are being fully utilized to improve the use of the last line antibiotics?
Yeah, thank you very much. And I think, as you point out, antimicrobial resistance is a huge problem. It is something that is affecting globally as well as here in the United States, and we do risk at some point not being able to have antibiotics to treat routine infections or those really life-threatening infections as well. The things that we're looking at, of course, working with BARDA and ASPR and with others to have better antimicrobial drugs, antifungal drugs, antibacterial drugs, et cetera. But those will take time. We may not even be able to find some of those, so we have to have other things that we're doing to make sure that we're preventing these antimicrobial resistant infections. One of those is infection prevention and control. So making sure that hospitals have the right way, that they know how to control and keep these infections within those facilities and keep transmission from happening there. Also, antimicrobial stewardship, so that we give guidance, and we have staff that are in facilities that know exactly what to choose based on what the antibiotic resistance pattern is within that facility. Better diagnostics, like you mentioned, so that we can see where is that AMR coming up, where is it happening. And then for us, we are supporting state health departments and local health departments with funding so that they have those experts in IPC, the infection prevention and control, and in antimicrobial resistance, so that we're connecting healthcare and public health in a way that we have not done before, so that we're actually addressing that problem of emerging antimicrobial resistance.
Thank you. Dr. Daskalakis, my district has the largest agricultural income producing district in the state of Ohio, and I'm concerned about the impact AMR has on livestock. What is the CDC doing to address the impact of AMR and infectious diseases on livestock, particularly with the outbreak of avian flu and how its contagion can spread?
Though I'll leave the AMR issue to Dr. Jernigan, I can comment about the importance of the relationship between public health and agriculture in our response to highly pathogenic avian influenza. So those relationships really, in that One Health strategy that bridge public health and animal health, as Dr. Jernigan said in his testimony, are critical in being able to respond not only to sort of routine events, but also to events like highly pathogenic avian influenza. So we have some great models in states where really that close interaction means that farmers are being monitored, farm workers are being monitored, and appropriate testing is happening to identify cases. I'll yield the floor over to Dan to speak specifically about AMR.
Yeah, just in terms of the in our center, we have a One Health office, which actually looks at those issues that do cross agriculture, animals, and humans. Antimicrobial resistance is not just a human problem. We have to work very closely with our other federal agencies and with industry to make sure that antimicrobials that are used for agriculture or animals are not going to lead us down a path where we don't have those antimicrobials to treat infections in humans.
Well, in my last 13, 14 seconds, real quickly, because again, when I look at my district and you see what's happened, I mean, we're talking about millions of birds having to be destroyed. We're seeing it, going into different types of other herds out there, and also humans contracting. What do you see real quickly on the horizon, how we can combat this?
In terms of combating antimicrobial resistance in that?
Right, and especially when we're talking about on the avian flu.
I think the best thing we can do, and I actually yield back to
Well, if
Dimitri, but I
the
just think
chair would-
surveillance for those
Sure.
pathogens.
Thank you very much.
Go ahead and answer.
Thanks for that question. So I think really sort of capitalizing on the One Health strategy is really important. And so creating really good connections with farm workers, good connections with producers to make sure that as we identify animals, we also are closely aligned with public health to make sure that we're monitoring workers. I think we're collaborating very closely with our USDA colleagues who are providing really clear guidance in terms of strategies to address the on-the-ground events among animals. And again, our public health colleagues working closely to monitor the human health situation.
Well, thank you very much. My time has expired, and I thank the chair. Thank you.